Doug Gregory. I'm the Residency Program Director here at the University of Tennessee in Chattanooga. So our clinical training environment is very unique. We have a very large catchment area, which allows patients to come from both very rural areas as well as from a more inner city area, which brings a variety of disease processes. Also, our emergency department is very busy. Our volume is high for the number of residents that we have, so our residents get exposed to a number of patients during their residency training. Residents see patients from day one that are very sick. We don't stage residents through the course of their 3 years where you're only seeing the most acute patients during your 3rd year. So from day one, you're going to see a variety of patients and a variety of patient illnesses, regardless of acuity.
I'm Spencer Carter. I'm a 3rd year resident from Decatur, Georgia. I found that this was going to be the best place for me to train, where it was just like, it's so busy, everybody's so sick, and that you get to learn so much. So when you do get that patient out in the community, or you do get that patient that needs you, you are well trained and well adept for all procedures, for all workup. And I find that here, you're not going to get a better place in this region to get this kind of training.
So residents in our department work with attendings one-on-one. So every patient that a resident sees, our attending is going to see behind them, and so there'll be that one-to-one teaching that occurs during that process or that interaction.
My name's Kelsey. I'm from Cartersville, Georgia, which is about an hour south of here, and I'm in my 2nd year. Certainly, we all expected in residency to grow. We all expected to learn. We all expected to get the procedures and all those kind of things. But being in residency, particularly here with the patients we get to take care of and the staff we get to work with and the attendings we get to work with, I have come leaps and bounds from a scared intern to now being here a year and a half later, as far as my confidence, as far as my knowledge, and then really being able to perfect the things as far as like knowing bedside manner and being comfortable taking care of, and again, loving on patients like we get to do.
Because the residency program is so small, we're able to promote a family-friendly environment. We can have gatherings at attendings' houses when we're not under a pandemic, and really get to know each other as people.
So I'm Elijah Wyatt. Our faculty are truly engaged in teaching and also being there for us as human beings. I feel like you can have a normal conversation with our faculty. They're willing to give you advice not only about medicine but about life, and they also have high expectations, and so I think they really drive us in becoming a better physician and person.
So my name is Mayfield. I'm an intern, 1st year resident. Yeah, the program's definitely made sure that I was a mom first and addressed those issues and those concerns before coming back into residency. And then when it was time for me to come back, it was an easy transition. I was, able to step away when I needed to, make phone calls when I needed to. I'm breast pumping, so pump when I need to. They've just been very supportive of making sure that I'm a mom first, and mom is gonna stay there. Residency will finish when residency finishes, so.
One of the other aspects of our program is we have several fellowships. We have an ultrasound fellowship that's led by Dr. Ben Smith, who is a world-renowned leader in ultrasound education, as well as an EMS fellowship with a very strong emphasis on Life Force, which is our flight medicine program.
My name's Brittany Walsh. I'm one of the clinical instructors here for the residency program. So when I was a resident, I actually did a rotation for a month with the Life Force program. So I did several flights with them. And that kind of goes into, as well, the team-based approach to taking care of patients in the emergency room. We get handoff from patients from the EMS providers as well as Life Force providers, and this let me see firsthand the care that they're providing and be able to understand, you have to be able to make sure the scene is safe, what kind of abilities and things they can do to take care of patients in the field, and what they can actually do within the constraints of a small space on the helicopter on the way here.
If you're not familiar with Chattanooga, it's a great place to live. We're nestled down in the southwestern portion of the Appalachian Mountains, which leads to a great number of recreational opportunities. But one of the great things about Chattanooga is there's also culture, there are breweries, there are great restaurants. It's easy to get out of the city to do hiking, biking, rock climbing, whatever your forte is. And likewise, you can also have a professional career in Chattanooga without having to live in a really big city. The natural environment around us is spectacular. If that's your thing, this is a great place.
My name is George Gu. I'm one of the interns at the University of Chattanooga Emergency Medicine Program. Being from Atlanta, Georgia originally, I was a city boy for a while. Coming down to Chattanooga, You know, there's definitely a lot more outdoor activities that I'm able to do. You know, my wife and I, we love going down to Renaissance Park. You know, we live downtown, so it's literally a 5-minute walk from us. You know, we love walking our dogs. You know, on the weekends or, you know, days where I'm off, you know, we have the opportunity to go to Lookout Mountain, Signal Mountain, you know, Ruby Falls. There's just so much to do, you know, and if you're a water person, you know, you can always, you know, grab a kayak down the street and just go to the Chattanooga River and just, you know, raft down for an afternoon or go fishing. In the restaurant and the musical culture here, you know, you can go to, you know, the park next door and you can see people just playing, you know, instruments, you know, at the park. You know, I love it. It's great.